Which of the following is the term for the functional unit of compact bone? A. Lamella. B. Haversian canal. C. Osteon. D. Trabeculae. The answer is C. Osteon. The functional unit of compact bone is the osteon. The osteon is formed by concentric layers of compact bone called lamellae. These surround a central canal called the Haversian canal. Trabeculae are the functional units of cancellous, spongy, bone. Which of the following cells is responsible for depositing hydroxyapatite into bone matrix? A. Osteoclasts. B. Osteoblasts. C. Osteocytes. D. Myelocytes. The answer is B. Osteoblasts. Osteoblasts are the cells responsible for the deposition of hydroxyapatite into bone matrix. In addition to hydroxyapatite, they synthesize collagen, osteocalcin, and osteopontin. Osteocytes are undifferentiated osteoblasts, while osteoclast cells function in opposition to osteoblasts by removal of mineralization from the bony matrix. Myelocytes and normoblasts are both hematopoietic cells of the bone marrow and do not take part in bone mineralization. Which of the following is in the Haversian canal? A. Red bone marrow. B. Periosteum. C. White bone marrow. D. Capillaries and nerves. The answer is D. Capillaries and nerves. The Haversian canal allows capillaries and nerves to pass through the cortical bone to nourish osteocytes, osteoclasts, and osteoblasts. Both the white and the red bone marrow are contained within trabecular bone, while the periosteum is a thin, highly innervated membrane on the outside of bone. In regards to bone marrow, red marrow is primarily made up of underscore cells, while yellow marrow is primarily made up of underscore cells. A. Hematopoietic. Fat. B. Proliferating. Calcified. C. Active. Dormant. D. Erythrocytic. Leukocytic. The answer is A. Hematopoietic. Fat. Variation in color of bone marrow cells is not related to their level of activity, calcification, or the types of blood cells they produce. Rather, red marrow is primarily hematopoietic cells, both red and white progenitor cells, while yellow marrow is primarily composed of fat cells. Growth in long bones must occur at the dash. A. Epiphyseal plate. B. Diaphysis. C. Suture. D. Epiphysis. The answer is A. Epiphyseal plate. Growth in long bones occurs at the epiphyseal plate, a region of hyaline cartilage at the metaphysis of the bone. In adolescents and children, cartilage cells are ossified by osteoblasts to increase bone length. Once adulthood is reached, the epiphyseal plate becomes the epiphyseal line at the junction of the epiphysis and the diaphysis, the center of the bone. The diaphysis and epiphysis themselves are composed of mature ossified bone and do not proliferate, they are simply added to by transformation of cells in the epiphyseal plate. A suture is a fibrous joint of the cranium and does not contribute to the development of long bones.